I came here to work here, it's 18 years ago now, as a consultant obstetrician and gynecologist, and for the past 8 years I've been the medical director, now chief medical officer. This is a great place to work. The opportunities for doctors, both consultants and other doctors here, are immense. We have a population of over 500,000 people, and this is a population that has poor health indicators, particularly in areas such as cardiovascular disease, but also cancer and everything what you would expect actually in some of the poorest wards in England. So that means that doctors have the opportunity to practice their craft, to practice their skills that they've learned during training, and to develop those further. And we encourage our doctors to develop their service further, to look where quality can be improved, and to work together with the managers to provide better services for the population of East Lancashire. We have a consultant leadership development programme. This has been running for a couple of years now, and basically we take groups of consultants, usually mixed groups of both new consultants and doctors that have been there for a while, and we take them through an 8-month development programme that really puts them in touch with how they can get things done in the modern NHS. This is a great area to work in as well as the opportunities in your job. Of course, you're also looking when you come here to see, well, what is there for me? What is there perhaps for my family? It's a beautiful area to live in. We're very close to the Lake District, but also, of course, even closer is the Forest of Bowland, with some of the most beautiful countryside there is in the country. So they're very good schools, a couple of grammar schools if you have children, and generally it's a nice place to be. It's a nice place to live with your family. We have a very strong clinical team here, and that's right through the clinical leaders and divisional directors for each of the 4 divisions, has a clinician at the top of it, through the medical director, chief medical officer, associate medical directors, but right down to clinical directors and their teams of consultants. And we truly believe that it has to be the clinicians that lead the teams. It's clinicians who know what's best in terms of clinical services and how to improve quality and how to develop those services further. In a new consultant or a doctor, I'm looking for someone who's not just very well trained and has the skills and the knowledge to practice their particular specialty, but also who's very caring, who's empathetic, and who's hardworking, and someone who's not afraid of a challenge. If you're that person, then you'll find yourself amongst friends here at East Lancashire Hospitals.